This is going to be a basic introduction into industrial hygiene. Industrial hygiene, by a standard definition, is the science of anticipation, recognition, evaluation, and control of workplace hazards that may cause an occupational illness or injury. And that's quite a lot. Now, industrial hygienists play a significant role in the management of health and safety programs, really in the areas such as like radiation safety, chemical and physical exposures, emergency response, indoor air quality, and many, many others. And this chapter, we're really going to be looking at industrial hygiene really from a viewpoint of pharmaceutical exposures in the workplace and how they can be addressed through the use of installing and maintaining containment systems. Before we go too deep into the subject, I really feel it's important to define a couple of things, especially since we're going to be using these terms quite a lot in our upcoming discussions. The first term to define is that of potency. Now, potency is the dose, or actually how much of a compound it takes to actually produce a response in a patient. Something that's defined as a potent compound typically will be something that has a therapeutic effect or more of a pharmacologic activity at anything less than 10 milligrams per day, which is a very small amount. Toxicity, on the other hand, is the ability of an agent to cause a harmful response in the body. So harmful responses can be anything like lowering your blood pressure or having skin rash or sustaining a headache. Some use these terms of potency and toxicity interchangeably, and that really can lead to a little bit of confusion. So I thought I'd just clear that up right front. Small molecules are synthetically made pharmaceutical compounds that can be used for a variety of purposes, but really for regulating biological processes, and typically they are less than about 900 Daltons, give or take probably a couple hundred depending who you ask. Now probably most of the compounds you're going to be working with, certainly a lot of the ones I was working with in containment, will be small molecules. Occasionally you'll have biologics that have some issues with it and they need to have those in containment. But we're really going to be focusing on the small molecule bit. And these things are developed really for medicinal purposes, and we tend to call them active pharmaceutical ingredients, or APIs. Now, the last definition is that of the occupational exposure limit, or OEL. This is a concentration that a worker can be exposed to during the course of their normal job duties without suffering any ill health effects. And these can be for 8-hour days, 40 hours a week for a working lifetime. And there's a variety of these types of limits, and these are really set by governments, like there in China, the central government of China, and they call those MACs, or maximum use concentration limits. Some are set by professional associations, like the American Conference of Governmental Industrial Hygienists, like the ACGIH. And then certainly there's other pharma companies that have actually developed their own exposure limits for the compounds that they actually work with and produce. We're going to cover all of those that apply to our situation in a bit more detail a bit later on. Now, throughout history, many people and events have helped to shape the profession as we know as industrial hygiene. And believe it or not, industrial hygiene, its roots can be traced back to Hippocrates back in 460 BC. Actually, in more recent times, in early Roman times anyway, a guy named Pliny the Elder actually perceived health risks to those individuals that were actually working with lead, zinc, and sulfur. And today, we definitely know that those compounds have some significant health risks. Fast forward a few hundred years, we have Bernardino Ramazzini in the late 1700s. He was really considered to be the father of occupational medicine. He wrote a lot of journals and books about the hazards of hundreds of different types of jobs, and even made recommendations for workers to actually protect themselves. Now, back then they didn't have containment at their disposal, but maybe they could do something else to protect themselves. I'm not quite sure what they did. Now the list goes on, but the industrial hygiene profession has now become a globally recognized profession with many different groups supporting it through research and non-governmental agencies, professional associations, all or which are really seeking for a better health and safety of all of our global workers. And for me personally, being an industrial hygienist working in the pharma industry, I recognize the health impacts associated with exposure to these potentially dangerous materials. In our case, we're really specifically speaking to the term pharmaceutical compounds, or these APIs. So I feel strongly that you need to understand the profession and how it really came about. So I want to share with you Some of the more historical facts as to what's driving health and safety in the workplace in the 21st century, specifically with IH mostly in mind. So let's begin back in the late 1800s, in England particularly. We had little young boys, typically less than 7 years old sadly, that were being used to clean chimneys. They were chimney sweeps. Note the picture there on the slide. They were exposed to carcinogenic black creosote dust, and sadly many of those little boys eventually developed testicular cancers. Fast forward a little bit, we have hat makers in the early 1900s, pretty much globally. They were found to have sustained mercury poisoning from some of the chemicals that they were using for processing these hats, which ultimately led to a lot of different types of neurological diseases, or as some called it, going crazy, and thus the term mad as a hatter was born out of that. Coal miners, historically, even today, have a significantly higher risk of developing asbestosis or black lung disease or even lung cancer. And then of course we have the famous radium watch dial painters, the little paint that seemed to glow like magic. Well, it wasn't magic, it was actually radioactive material containing radium, and many of those workers died of occupational bone cancers. So the list goes on and on, so it really gives you an idea of what occupational illnesses can be. Nowadays, in the pharma industry, we are working with increasingly potent and sometimes highly toxic materials that may not be fully understood from a worker safety perspective. Now I know for a fact from firsthand experience that no pharma company ever wants to have an occupational disease related to their specific product if they can ever prevent it. And this is why containment is so very important to the pharma and also the biotech industry, and why it's very important for any challenge testing to be performed accurately and also according to established best practices. Now we tend to focus on manufacturing for commercial purposes, making large quantities of drugs or APIs, but even much earlier in the pharma process, back in the research days or even the development stage, we really need to protect our workers through the use of contained systems as well, because way in the early phases of these things, we don't have a lot of tox information, so it's not very well understood of what the hazards of these compounds that they're working with. And I'll elaborate a lot more on the toxicology a bit later in some of the upcoming chapters. So in those cases, it may be even more important to protect workers against exposure due to these unknown hazards of these compounds. So we can have containment systems being used very early in the process of pharmaceutical development, all the way through full-scale manufacturing. And industrial hygienists play a significant role in designing and testing of these systems. Industrial hygienists are professionals who assess workplace risk. Now, classical risk assessment traditionally has been done through the use of some basic sampling tools and also through the use of using our senses, such as looking, listening, touching, smelling, and even sometimes tasting, unfortunately. Although smelling and tasting has really never been a good practice, but it was done over the years. Now, industrial hygienists today in the workplace have a wide range of highly specialized tools and techniques to determine these risks of exposure. And we're going to talk about some of these tools throughout the training, but it's primarily going to be focused on assessing the potential for exposure to airborne pharmaceutical compounds, but we're also going to spend some time on dermal exposures as well. And these assessments will be conducted by performing a containment test, or a challenge test as we sometimes call it, using a surrogate material such as lactose or riboflavin or some other compound, maybe even like naproxen sodium, or some other dry powder that really behaves like an active pharmaceutical ingredient would. So we'll still use our senses to observe what's taking place in this particular challenge test, but we're also going to try and determine where the weak points are in the system from the overall design test. Really, we rely heavily on the data that comes out from the sampling test itself and not so much what we see, but certainly both of those go hand in hand. So as we go through this training, I am going to speak quite a bit about some of the notes you need to take when you're doing these testings. That way when you go to write a report, you can remember back and reference what you wrote down on the notes. That way we can put it all into the report and issue a report that's that much more meaningful. Our senses are only so good. We can't visualize microgram quantities of pharmaceutical dust in the air. It's just not visible to the human eye. So we really must have accurate and representative assessments through the use of our industrial hygiene tools. So you may be asking yourself, why do we need to perform containment challenge testing, and what does an industrial hygienist have to do with it all? Hopefully you will understand what this is in just a little bit and over these next couple of days. Now try to understand the APIs are specifically designed to be biologically active with as low a dose as possible. And over the past few decades, pharma companies have continued to increase the potency of their drugs with some big successes in doing that. Now this makes manufacturing much more efficient, and it makes it much less costly for producing finished drug products. Many of these newer drugs have exposure limits of less than 10 micrograms per cubic meter of air and are deemed high hazard or particularly dangerous, or some people call them a potent compound. Now with these exposure limits getting lower and lower, we must now also concern ourselves with the additional possibility of any dermal exposures as well, since many of these drugs can be absorbed through the skin or even the mucous membranes. And this is why containment for processing pharmaceutical compounds is very, very important. The benefits for performing containment testing of your equipment are really too numerous to fit all on this particular slide. The primary benefit is that you can really sell your equipment knowing that it's going to provide you with containment down to a specifically designed limit. This testing data gives the purchaser, in this case the pharmaceutical company, a lot greater confidence that your equipment will protect their workers. This is very, very important to the pharma and biotech companies, as there's serious consequences for not controlling exposures to their workers. There can be criminal or even civil litigation against companies that fail to provide for a safe workplace. It's also the moral and ethical thing to do. Pharma companies don't wish to harm their employees. Doing so would lead to bad publicity, reduced employee morale, reduced productivity, and ultimately reduced shareholder value. Now there are some costs associated with performing containment challenge testing, but these are actually quite small of the overall cost percentage of just the equipment itself. And in my experience, I would say that any reputable pharma and biotech companies would certainly be willing to pay a little bit extra to get the assurance that the equipment performs as it's designed. So when we assess containment capability, we are evaluating three things mainly. First is the potential for the exposure to the actual operator or the worker working on that piece of equipment. Secondly is the potential for the release of the material into the immediate work area, which could impact other workers in the area, but it also could contaminate other pharmaceutical processes, and that's never a good thing to have happen. And then lastly, the third one is the potential for the release into the environment. Now we can assume that if we can control exposure to the worker, we can control exposure to the facility and also to the environment. And this is generally the case, but it's really beyond the scope of this particular class to look into the design considerations for the environment. So things to consider, like where does the wastewater rinse go for clean-in-place systems, assessing the potential for a dust explosion in a dust collection system, or finding leaks from an exhaust scrubber system. So we're really going to try and stay focused on the exposure to the operator, but also more importantly the cross-contamination potential within that facility, and save the pharmaceuticals in the environment topic as a separate issue unto itself. It's important to note from our standpoint, what we're doing falls in line with the thinking of the big pharma companies. Now, pharma companies are in the business of making APIs and finished drug products as well. So elimination of these hazards is not really possible to reduce exposure to the workers. Primarily that's due to because the API is their business, and if you eliminated that, well, they wouldn't really have any business. They can, however, provide engineering solutions or containment solutions to eliminate or at least reduce the risk of exposure. So in most cases, the first step for pharma companies that they're going to take to reduce their exposure risk is to provide some form of engineering control. And this is great for your business because you're right near the top of all those possible control measures that you see on the slide. Other measures they can take are substitution, but that's not really an option for a pharma company either. They have administrative controls, and those certainly will be used as this covers the creation of standard operating procedures in the workplace, putting up labels and signs, and even conducting some safety training for their employees. And then lastly is the use of PPE, or personal protective equipment, which can work well. Industry uses these quite a lot, but if that PPE fails or the worker doesn't use it properly, really there's going to be a high likelihood of an exposure. And I've seen this happen more often than I would like. There tends to be a bit of complacency with a worker wearing PPE, like they feel they're Superman or they feel like they're adequately protected, when in reality the hazard is still very much present in the workplace, and there may only be a thin barrier, like a glove material, between them and sustaining an actual exposure. This is not something the pharma company wants to have happen. So they will tend to go with better controls like containment devices for their pharmaceutical processing equipment. These control methods are really broken down into two different types: capture systems versus containment systems. And I think we all know which one's better. Capturing is a very unreliable method for controlling exposures. I prefer to call capture systems as psychological dust control, as it really provides the operator with a feeling that the exposure is being controlled, but in reality, it's doing very little. Now on the other side, using isolation systems to contain pharmaceutical ingredients is certainly much, much better. It's more complicated and more costly, but in the long run, it certainly provides tremendous benefits to not only the worker, but also the pharma company. So let's talk a little bit about why exposure to these pharma compounds is considered bad. And in the pharma industry, there's examples as early as the 1940s where exposure to reproductive hormones, in this case estrogens, in the male workers led to some very negative side effects, such as enlarged breasts, reduced libido, and having some fertility issues as well. In more recent years, there's more notable studies and papers written regarding occupational exposures to pharma compounds. Some of these resulted in some significant acute illnesses and also resulting in some more chronic conditions like cancers as well. So one question I get a lot is, if one is making a drug that has beneficial effects in patients, why can't the workers be exposed to it? If it's safe for a patient, then it's probably safe for a worker to be exposed to it, right? Well, that's not the case. We need to remember that people who are taking prescription pharmaceuticals are under the direct supervision of a doctor to manage their ill health, but also their health symptoms as well. Manufacturing employees that work for pharma companies are not being observed by a doctor. We know nothing about their personal medical conditions or what other medicines they may be taking or what negative drug interactions there could be. So it's very, very dangerous for us to assume a little bit of exposure would be good for them. So we must assume that any exposure to a pharma compound in the workplace is considered bad, and this is standard across the pharmaceutical industry. There's a number of historical examples of poor handling practices that have actually led to worker exposures. Antibiotic production, steroids, skin sensitizing agents, and a whole load of them more. Now the severity of these health effects from bad engineering controls or even poor handling practices are directly related to a few key factors. Most of these are really obvious to us. You can see them on the slide, and they really can be influenced by our particular actions that we can take. We have the duration of the exposure, or how long the workers actually be performing the operational task itself. We have how frequent the worker may be exposed. Is this a daily operation, or is this a once-a-month type pharmaceutical processing operation? How high the concentration is in the air, and we're going to hopefully be able to test for that. And then lastly, how much of the material is actually absorbed into the body. And this last one really requires some input from our toxicologists to help determine. That one's a very tricky subject into itself, and it takes specialized professionals to deal with that. So it's really out of our control. But the other three are not. So it's very, very helpful to know if any of this information is available. Some of the compounds are readily absorbed through the skin or into the bloodstream actually after they inhale it. We're going to speak a bit more about toxicology a bit later, as it's certainly key to understand the toxic bit before we can progress into some of these other chapters. These health effects may be temporary and go away once the exposure to the compound has stopped, or in some cases we can have long-lasting impacts like causing tissue damage or genetic mutations, or even causing some form of occupational cancer. There will be varying levels of severity depending on the hazards associated with this particular API. So it's also important to understand that not only the hazards of the API, but equally important how the containment system is planned to be used. What types of processing will be done, how many people will be using it, the size and dimensions of these people, the weights of the material being handled, the list goes on. So I've seen some really great glove box isolators where the operator can't reach into the back to retrieve a tool. Or better yet, having a pass-through port that isn't large enough to move materials in and out of the isolator. So the control measures can very quickly become unusable if it isn't designed well. Now, successful containment systems are designed knowing all of this information up front. So this is going to ensure that it's built to the user's anticipated needs, but also within the appropriate ergonomic guidelines as well. So I want to spend a minute explaining a bit more detail about occupational exposure limits, or OELs. We will later speak to other types of limits as well, but this is really just a good place to start. Now, OELs are one of the primary drivers behind the design of a containment system. An OEL can be an airborne concentration at which a worker can be exposed to 8 hours a day, 40 hours a week for a working lifetime without really suffering any ill health effects. These OELs are calculated by experts in the field of toxicology, and it's really derived from both animal studies and also some human clinical data. And it's intended to be protective of even the most sensitive worker population, and in these cases we tend to assume that being women of childbearing age, or those that are pregnant or even trying to become pregnant. These OELs take into account all routes of exposure, such as inhalation, dermal exposure, ingestion, and even injection. Now, for our types of pharmaceutical equipment, we really only need to be concerned with the inhalation and the dermal exposures, as those are really the two most likely routes of exposure. The likelihood of a worker ingesting or injecting an API is far less likely in the workplace, and it could typically be controlled through workplace training, hand washing techniques, gowning operations, or maybe even some other administrative controls. So as you can see on the slide, here are a few examples I can show you for some of the common pharmaceutical products that I just kind of grabbed off the internet. You can see there's a wide variety ranging anywhere from 3,000 micrograms per cubic meter for ibuprofen all the way down to 0.001 micrograms per cubic meter of air for this peptide hormone called nafarlin. Many of the pharma products we're going to be working with are certainly in between those. Those tend to be the outliers. Most of them are going to be in the range between 1 to 10 micrograms, maybe even a little bit less than that. Now, it's generally assumed that any exposure limit less than 10 micrograms per cubic meter of air is considered a potent compound. And for these compounds, worker protection is certainly a very high priority. Even for the high OELs, like ibuprofen, worker safety isn't as large of a challenge or even a concern, but it's certainly a concern from a quality perspective. So no cross-contamination events can ever occur in a plant. So it still needs to have some emphasis put on those. So it's very hard to put numbers into perspective. I want to try and help you with that. So we'll look at this particular example with salt. So let's say the average grain of salt weighs just 150 micrograms. Well, let's assume we have a very small conference room of 3 by 5 by 6 meters, or the equivalent of 90 cubic meters. So if we contaminated the room air with just 10 grains of salt, what would the airborne concentration be in the room? Now obviously the answer is right there on the slide, but basically if you take the number of micrograms of salt divided by the volumetric space in the room, we'd get a concentration of 17 micrograms per cubic meter of air. So if that were an actual API that we just dispersed equally into the room, you would very likely be over your allowed exposure limit. And that's just with 10 grains of salt, which really isn't very much at all. Now imagine a work process with a leak or a spilled powder where there would be significantly more powder present, and imagine how high the exposures would be. I've seen exposures in the thousands of micrograms in my experience. As you can tell, it doesn't take much API to really exceed these exposure limits. And at those lower levels, you just won't see it. And this really drives the need for containment tests to determine its performance. So we've covered all the basics as to what is industrial hygiene, how it's evolved over time, the importance of containment testing, the health effects of pharmaceutical compounds, and also a little bit on exposure limits. This has provided you with a good foundational awareness for our next chapters. So let's move forward with the next. We'll see you in a bit.